My name's Patrick Lusty. I'm a consultant orthopaedic surgeon. Practice both privately and in the NHS at Southend Hospital and at the Spire Wellesley Hospital. I became a doctor because I wanted to feel at the end of the day I'd done something worthwhile. Hip and knee surgery was easy. I wanted to choose not a specialty with one of the best operations in terms of curing people. And I think there are three amazing operations in medicine or the world when I was young, when I was choosing, which was a bypass surgery, making people live longer, cataract surgery, making people see, and hip replacement surgery, sort of making the lame walk. And that's when I started off becoming a hip and knee surgeon, because of the amazing results with hip replacement surgery, and subsequently also a lot of knee surgery, amazing results. I think seeing people when I say goodbye to them, when they've got better, is the most enjoyable bit of orthopedics. Having people who've been unwell, who are grateful to have recovered and not need my input anymore. I think I'm very honest and direct about what is wrong, what it involves, and their likely path through their treatment.